Assalamualaikum warahmatullahi wabarakatuh. So now our group will be presenting about the laboratory diagnostic of respiratory tract infection. This slide was prepared by AMIN, NICH, ZARIN and Riffah. So now let's just jump into the introduction. Respiratory tract infection are the most common illnesses worldwide and can range from mild to life-threatening conditions. Accurate and timely laboratory diagnosis is essential to identify the causative pathogens, guide treatment, and prevent complications. This presentation explains the main diagnostic approaches used in medical laboratory, including rapid tests, culture methods, antigen detection, and molecular techniques to provide a clear understanding of how respiratory tract infections are detected and confirmed. Move on to the culture methods, which is one of the most important diagnostic tools in respiratory tract infection. Culture is considered the gold standard because it allows us to grow the actual microorganism directly from the patient samples. This helps us isolate and accurately identify the pathogens, whether it is bacterial, fungal, or sometimes viral. A major advantage of culture is that it allows antimicrobial susceptibility testing, also known as AST. Unlike rapid tests and molecular tests, AST show which antibiotic or antifungal will work best. So overall, culture provides a very reliable diagnosis and guide the correct treatment. To perform culture, we must collect the correct specimen. Common specimens include sputum, throat swabs, nasopharyngeal swabs, tracheal aspirate, and bronchoalveolar lavage. Or for tuberculosis, early morning sputums or induced sputum is preferred because it has a higher bacillary load. Proper collection and transport are extremely important to keep the organism alive, otherwise they may not grow in the culture. In bacterial culture, common respiratory pathogens include Staphylococcus pneumoniae, Haemophilus influenza, Staphylococcus aureus, and Pseudomonas aeruginosa. These are grown on media such as blood agar, chocolate agar, and McConkey agar. After the colonies grow, we identify them using gram stain, biochemical test, or Maritov. AST is then performed to determine the best antibiotic. For the tuberculosis, the culture process is more specialized because Mycobacterium tuberculosis grow very slowly. It requires special media like Lowenstein-Janssen or Middlebrook agar, and the sample must be decontaminated before inoculation. Growth usually takes 2 to 6 weeks. Once the colonies appear, confirmation is done using AFP staining or a rapid identification test. TB culture is also used for drug susceptibility testing to detect multi-drug resistant tuberculosis. Next, media used in bacterial culture. There are different types of media used for different organisms. For example, blood agar supports organisms like Streptococcus pneumoniae and Staphylococcus aureus by observing the hemolysis to help the identifications. Next is a chocolate agar used for fastidious organisms like Haemophilus and Neisseria. For the McConkey agar, is a selective for gram-negative bacteria and show lactose fermentation. Next is clade agar, also help differentiate gram-negative organisms. BCYE agar is used for Legionella phenophilia. For seborrheic dextrose agar is used for fungal pathogens such as Candida and Aspergillus. For the TB, special media like Lowenstein-Janssen, Middlebrook agar, and MGIT are required. This is because Mycobacterium tuberculosis does not grow on routine bacterial plates.
Let me start with the basics. What exactly is rapid testing? Rapid testing refers to diagnostic tests performed at the point of care that deliver results within 15 until 16 minutes without requiring transport to a laboratory or overnight culture. These tests are designed to be simple, non-invasive, and performed in clinical settings. Examples: consultant room, which is doctor office, urgent care, hospital, emergency department. These tests primarily used to approach rapid antigen tests and rapid molecular tests. The samples are typically recollected using nasal, nasopharyngeal, or throat swabs, which are non-invasive and patient-friendly. This immediate turnaround time is what makes rapid testing so valuable in clinical decision making. Now, let's dive into rapid antigen tests. The principle behind this test is straightforward. They detect viral proteins using immunoassays. Most rapid antigen tests use a lateral flow or immunochromatographic format, similar to how prenatal tests or COVID-19 home tests work. Some use fluorescent-based immunoassays. The turnaround time is impressively fast, typically 15 to 30 minutes from the sample collection to the result. However, it's important to note that the sensitivity is lower compared to molecular tests, ranging from 70 to 90%. This means there is a higher chance of false negative, so a negative antigen test doesn't completely rule out infection. Let's move to the molecular test, which represent the next level of sophistication and accuracy. The principle here is that this test detect viral nucleic acid, DNA or RNA through amplification technique like RT-PCR or isothermal amplification methods. This is more specific and sensitive than just detecting proteins. Instead of a simple lateral flow cassette, rapid molecular tests use small cartridge or chip-based point-of-care platform. You load the sample into a cartridge, insert it into an analyzer, and the machine performs the amplification and detection automatically. The turnaround time is slightly longer than antigen test, typically 20 to 60 minutes because amplification takes time. But the reward is much higher sensitivity, often exceeding 95%. This means far fewer false negative and more reliable diagnosis.
Antigen-based diagnostic methods are widely used to detect specific pathogen in clinical sample. The two main methods are ELISA and the rapid influenza A and B test cassette. So first, ELISA. For the principle, ELISA works by using antibody to detect a specific antigen or antibody in a sample. When the right antigen and antibody meet, they attach to each other like a lock and a key. The antibody is connected to an enzyme that can produce a visible color change when a substrate is added. If the target antigen or antibody is present, a color change occurs, indicating a positive result. For the enzyme reaction, after the target antigen or antibody bind to the coated surface, a secondary antibody linked to enzyme is added. If the target is present, this enzyme linked molecule bind to the immune complex. A substrate is then added, which react with the enzyme to produce a visible color or fluorescent signal. The appearance and the intensity of the color indicate the presence and quantity of the target antigen or antibody. Specimen for respiratory can detect by ELISA are nasopharyngeal aspirate, nasopharyngeal swab, nasal swab or nasal wash, throat swab, bronchoalveolar lavage fluid for several cases, and sputum. Second method is rapid influenza A and B test cassette. For the principle, this test detect influenza virus antigen in nasal or throat sample based on the antigen-antibody binding. So antibodies on the test strip specifically recognize influenza antigen. Colored particles, usually gold, coated with the antibody bind to the viral antigen if present. The resulting the antigen-antibody complex are captured at the baseline, producing a visible line. A control link ensures the test is working properly. Positive results show both test and the control lines, while negative results show only the control line. For the antigen binding mechanism, influenza viruses have surface proteins such as hemagglutinin and neuraminidase. So the test strip antibodies are designed to specifically recognize this antigen. When the antigen are present, they bind to the colored antibodies and forming an antigen-antibody complex. So this complex move along the strip to the test line when the immobilized antibodies capture it. So accumulation of colored particle produce a visible line. This process works like a lock and key mechanism as only matching antigen generate a signal.
Now, let's move on with the principle of molecular microbiology. Molecular microbiology uses the principal detection of analyzing the nucleic acid for RNA or DNA of the microorganism to determine the phenotype exhibited by them using the combination of PCR and mass spectrophotometry or jet electrophoresis. The diagram shows the simple flow of specimen collection to lab testing. Type of PCR. There are a few types of PCR method for molecular testing, namely real-time PCR, target-enriched multiplexing, nucleic acid sequence-based amplification, sequence-independent single primer amplification, and so on. Each method uses the same principle as discussed before, but the outcome of the process may be slightly different, varying with the test purpose. As for detection method, there are two main detection mechanisms of PCR, namely monoplex and multiplex format. Monoplex format is a single target in a reaction, while multiplex is a multiple target in a reaction. Monoplex also provides a higher target specificity, while multiplex allows simultaneous detection of a pendant. For the last part, let's discuss about advantages and disadvantages of molecular method compared to traditional method. For advantages, it gives a higher sensitivity and specificity result, shorter turnaround time, and also high throughput processing. As for the disadvantages, this method is not available at all health institutes, possibility of false positive when contaminated, and also use high cost for the reagent and equipment.
Test for respiratory tract infection, use quick test, PCR and culture to find the germs causing infection. This method help doctor choose the right treatment and prevent the illness from getting worse. That's all from us. Thank you.